Good day, everyone. I welcome you to the Richards Clinic online educational series. Today, we are going to be looking at how to go about managing or treating your arthritis. Is it better to manage it or to treat it? Of course, many of us may not understand these two important factors, managing and treating arthritis. When you are focused on the symptoms of arthritis and taking treatment for those symptoms, you are simply managing it. But when you are treating the root cause of the symptoms, which is the degeneration of the joints, you are treating arthritis. And the outcome of the two is different. Management can reduce the symptom for a while. Treatment can heal the arthritis. Of course, pain is one of the most terrible diseases one can ever imagine, especially chronic joint pain. It's difficult to imagine waking up in the morning with pain, living the whole day with pain, going to bed with pain. A vicious cycle like that. It can make life very miserable. And arthritis is so terrible that it does not affect only one joint. Every joint in the body can be affected. The wrist, the lower back, the knee, the neck, the hip, every mobile joint in the body can be affected, including the ankle, the elbow, all can be affected. And as we have learned, the problem with joint or with arthritis most times starts with the ligament. For one reason or the other, the ligaments can be sprained, it can get inflamed. Ordinarily, the ligaments are whitish, strong, tough bands that hold the bone. If they don't get inflamed, they can even get degenerated by one reason or the other. And when these ligaments begin to suffer these issues, they begin to get weak, start failing in performance of their function. The affected joint begins to move more than it's supposed to move, and that puts pressure on the underlying cartilages, which begins to break. At one spot, from one spot to two spots, three spots, it begins to eat off. So there's a mechanical as well as a chemical event going on, which encourages the progressive destruction of not only the ligaments as well as the cartilage of the joint. That particular joint is already jeopardized. If it's a weight-bearing joint, whenever the person stands up, the pain comes up. Most of the joint will begin to, the mobility of the joint begins to reduce, which is what we call loss of function of the joint. At a particular stage, the joint begins to develop what's called bone spurs, which are outgrowth of bones, and they begin to narrow the joint space, making it difficult for the person to bend the joint. And all these things cause pain. And what does the person do? The person will first of all like to tackle the pain. Tackling the pain is not the problem, but concentrating on the pain alone is where the problem is. Taking supplements, doing exercises, and some going to the extent of injecting steroids into the joints. But at the end of the day, these things cause more problem than good. What should one do? Step by step. Make sure you meet a doctor who is well experienced in joint matters. He should examine you and send you for diagnostic test. That is the only way to diagnose arthritis. because it will show the damage we are talking about. Depending on the one can afford X-ray, CT scan, MRI to make a proper diagnosis, because it's when you know what is going on that you will now know what to treat. And it's good to take home today that there's no medication you will take by mouth that can go to that particular joint and heal it. So no matter what anybody advertises and says, the treatment of the joint has to be in the joint itself. And very natural healing treatment has come to be the best. And that's what we call regenerative therapy, where a tissue, a cell of your body is taken and injected into the joint, which releases growth factors, and they gradually heal the ligament, the cartilages, and even the bone. This is the real deal. This is where the treatment of arthritis lies. So no matter what you take by mouth, you have to do the treatment directly on the joint. And the good thing, this treatment works anywhere there is arthritis, the shoulder, the ankle, the knee, the hip, anywhere. And they are so efficient because of the way they work. When you inject this PRP, or what we call mesenchymal stem cell, into the joint, they release growth factors and attract what is called stem cells around that place, which will stimulate the growth of new tissues. And the new tissues that are grown are those that are damaged, especially the ligaments and the cartilage. Just as you see in the picture, from a damaged joint to a healthy joint. That's what the treatment does, and there's no other treatment that does this kind of job. So it is all about understanding what arthritis is and knowing the right thing to do. If one continues to treat the symptoms, taking painkillers, the end point might be that the person will get to the point where surgery is inevitable. But to avoid surgery, it's good to start regenerative treatment early enough. Take good diets, optimize your health, and you will realize that the joint can heal back to normal. All the difficulties and the pain the person will live with at a point will come to be a thing of the past, and you walk strongly and healthy. It is possible for one to live pain-free. It's possible for one to live healthy. It's possible for one to live happy. Thank you very much for listening.